Whoops, I'm a few minutes late today, so I'm so sorry, but I'm working on the coolest thing. As most of you know, I have been, I think I shared this with you, I've been doing a deep dive into thyroid. This is a very selfish thing I've been doing because my thyroid has been totally mismanaged by traditional medicine. And I know I talked about it last week. I'm shocked that I even have a patient who goes to an endocrinologist and the endocrinologist was only doing a TSH. 1 out of 9 tests is being done by a specialist. That really infuriates me. I expect that from a PCP, because that is the insurance standard. 1 test, 1 TSH. But I expect more. I expect more from a specialist. Anyway, I have had many issues based on, my history of thyroid cancer, my, no one ever getting more than a TSH on me. So it's complicated. However, I have been doing a whole lot of research, and of course, like with everything, all my hours of research, I don't like to go to waste. So I created a little bit of a masterclass. I'm going to talk about thyroid management on Saturday when I am at the Youngstown Drip holistic. They're doing a holistic day of holistic health, and I am teaching a 30-minute workshop, and I'm going to be talking about thyroid disease and autoimmunity. So if you're around, if you're local, come on. It's all day. I'm teaching around 1:20. I can double check that if you need the date. If you need the time, let me know. So here's the thing. TSH is not even an indicator of your thyroid. It is an indicator of your pituitary gland, right? And that is all we're testing. That is not enough. TSH is simply how much thyroid stimulating hormone that your body is putting out. That's not your T4. It's not your T3. It's not talking about autoimmunity. It's not talking about thyroid antibodies. It is missing so much. So, that fatigue, even if you sleep a lot and you wake up and you're still exhausted, how about that weight gain? How about that brain fog? How about thinning hair? I hear that all the time. And there's never one simple answer, but it is a lot of things that add up together. I talk about this as being like one drop in the bucket. So you have one drop in the bucket, one drop in the bucket, and then eventually all of these drops, the bucket overflows. This is with everything. This is systemic inflammation. A drop in the bucket is the mosquito bite. 2 drops in the bucket is a really bad reaction to that mosquito bite. And then you have more drops, and before you know it, you have autoimmune diseases because the inflammation has just gotten systemic. So that can affect your thyroid. That starts in the gut. It can affect every system of your body. Feeling cold all the time, difficulty concentrating. These are all symptoms of a hypoactive thyroid. So let's talk about it here. Your TSH is made by your TSH is made by your pituitary gland. That's in your brain. It's not in your thyroid. This tells your thyroid how much thyroid hormone T4 to produce. And then the T4 is converted into T3 in your liver. So these are the 3 minimum that should be done. TSH is basically how much thyroid hormone, how much thyroid your brain is telling your thyroid to produce, your thyroid gland. TSH stands for thyroid stimulating hormone. So it stimulates your thyroid to produce your thyroid hormone in the stored form of T4. Then it's converted to T3. So here's the issue. TSH has a pretty wide range. The Goldilocks perfect range for TSH is between 1 and 2. If it's not between 1 and 2, then you need to take a closer look at your T4, then look at your T3. We like T4 and T3 to be the upper 2/3. Okay. Hey, Karen, we like it to be in the upper 2/3. That's optimal. So for example, if you have a normal T3 of 3.8, your doctor's going to say you're fine. But if you look a little bit closer, and if your T4 is low, and then if your T3 is really low, even if they're normal, we like the upper 2/3 of normal, okay? And then if you have a high reverse T3, if you're stressed, if you've got a lot of inflammation going on, reverse T3 tells your liver to slow down the conversion. So when that number's high, we see low T3. So these are just 4 of the 6 that, in my opinion, absolutely need to be obtained. Your TSH, your free T4, your free T3, your reverse T3. Then the 3 others that are never gotten or rarely gotten unless they suspect you've got cancer. TPO antibodies. This is your primary autoimmune marker. So Hashimoto's disease, Graves' disease. One's hypo, the other's hyper. Graves is hyper. Hashimoto's is more common, I believe, and that is hypo, okay? So that TPO antibodies are the first autoimmune marker. Then you have thyroglobulin antibodies, and these are the secondary autoimmune marker. So if they only get TPO antibodies, I believe they are not elevated in 10 to 15% of people who have Hashimoto's. So if your doctor's getting TPO antibodies and you still feel crappy, then if they need to get thyroglobulin antibodies, because 10 to 15% of Hashimoto's patients have this elevated and not the TPO. So you've got the primary autoimmune marker, the secondary autoimmune marker. Then you have it's a tongue twister, thyroid binding globulin. And this will show if you have a transport issue. Because, I talk about our bodies, like we've got a ton of systems happening. So, just imagine you got little work crews everywhere. Some are working on transporting nutrients. Some are working on decreasing inflammation, taking the garbage out. Some are working on detoxifying, opening up the detox pathways. All of these things have to be working well for the whole orchestra to work well. And the thyroid binding globulin shows if you have a transport issue. That could mean that your T3 isn't being carried into your tissues properly. Raynaud's disease. Have you heard about Raynaud's disease? I was diagnosed with Raynaud's about 20 years ago, 10 years before a kidney diagnosis. So when you follow the path and you connect the dots, all of these stem from I don't have a thyroid. My entire thyroid, so basically the temperature, the thermostat of my body, hi Ann, the thermostat of my body is being managed by one pill, and it's a T4. So the initial intent was to suppress my TSH because assuming that all the thyroid tissue in my body was cancerous. So standard practice is suppressing the TSH. Well, now that I'm many, many years out, we can loosen up on that, okay? But because my thyroid, my TSH was so suppressed for so long, no one ever looked a little bit deeper to see how much free T4 I had, how much free T3 I had. If you don't have enough free T3, you end up being hypothyroid. So even though my TSH has always been hyperthyroid, I don't have enough T3 going on. Could be related to an elevated reverse T3, could be a thyroid binding globulin issue that I don't have the transport system happening. But one of the first things that happen is decreased peripheral blood flow. This is Raynaud's disease when, I don't know, they're not too bad today, but usually my fingertips are purple. And that is, they're always cold. My body temperature is usually no higher than 97. So that is what happened after 20 years of having a majorly suppressed TSH. Hyperactive thyroid based on a TSH alone, but not enough circulating free T3 to help with peripheral circulation. Now we fast forward to 8 years ago, and I was given a kidney diagnosis of primary glomerulonephritis. This is directly related to decreased T3 being perfused, and it damages tissues. So first peripheral vascular tissue, now kidney tissue. So this little issue with traditional medicine testing only TSH really has to stop. These minimum, you should be asking for TSH with a free T4, a free T3, and a reverse T3. Minimum 4 thyroid levels or tests. Ideally 6. In addition to those top 4, we want TPO antibodies, thyroglobulin antibodies, and thyroid binding globulin. So that's a total of 7. The 6 that no one is getting and the 1 that they always get. So insist on the first 3 of the 6. And then if it's necessary, you insist on the others. I would throw in at least the TPO antibodies, at least to have that primary autoimmune marker, unless your provider is thorough enough and they are getting other inflammatory markers such as COP or CRP, homocysteine, GGT, immunoglobulin A. These are all levels that I test in my root cause panel. So I am on a mission because had my thyroid been taken care of optimally, I would probably not be dealing with the issues I'm dealing with right now. And we deserve better. Absolutely, we deserve better. So find a provider that will listen to you and get the necessary tests. Do not be happy with TSH alone. All right, questions, DM me. You know where to find me.